symptoms, finding the right treatments, and communicating with healthcare professionals can often feel like an uphill battle. That's exactly why this podcast exists. Welcome back to PCOS Diaries, where we have real conversations about what it's like to live with PCOS and hear from experts who can make sense of it all. I'm your host, Ira Baga, and today we're talking about something that often gets overlooked: how movement and physical therapy can play a role in managing PCOS. Joining me is Dr. Lauren Hill, a physical therapist and a part of the Dignity Health group at Arizona. She is here to break down how physical therapy can help support PCOS management and what people should know about navigating their care. Dr. Hill, thank you so much for being here.
Of course. Thank you for having me.
Could you tell us a little bit about yourself and what got you interested in women's health?
Of course. So I have been a physical therapist for about 15 years and a pelvic health physical therapist for about 12 of those years. I became interested in pelvic health in my opportunity to be a part of the pelvic pain clinic that we have here at St. Joe's Medical Center. So I started with them in about 2014, and I was working as part of an interdisciplinary group with surgeons and residents to help develop comprehensive treatment plans for patients with endometriosis, PCOS, other kinds of pelvic pain conditions. And from that grew my interest in those various populations. So I started the pelvic health program in our outpatient rehab department at St. Joe's, which has now grown to include 5 pelvic health PTs, which is really great. And I think that my continued interest and passion for that patient population, especially PCOS and endometriosis, I would say, is just related to how much those conditions can impact our basic everyday functions, things that we take for granted that can really impact our quality of life and our mental health, such as bladder function, bowel function, sexual function, our ability to do basic everyday activities like sit for long periods of time, stand for long periods of time, work, exercise the way that we want to, move the way that we want to. All of those conditions can have really dramatic impacts on the things that we often take for granted. So I think just over time and interacting with that patient population, it helped to build my passion specifically for that population. And then I integrate a lot of yoga into what I do as well. I became interested in yoga when I was in grad school as a way to just manage stress and anxiety related to being in school. And I feel like over time, I learned, in especially pelvic pain conditions, how integral those movement patterns of yoga, the ability to create mobility and strength in one type of intervention, plus the major focus on breathing patterns and different types of pranayama practices, as well as just the general nervous system downregulation that a lot of times yoga provides. See, it was really helpful in that pelvic pain population that I was working with.
I think it's really inspiring, like all the populations you work with and like PCOS, and also really cool how you incorporate yoga into it. Like, PCOS can often feel like overwhelming to manage, and you said that yoga can help with like stress management and also just like other mobility. What are some simple movements or some simple like things that you think would help patients with PCOS?
Yeah, so with managing PCOS symptoms, you're right, it can definitely feel very overwhelming. Usually those patients are seeing multiple different types of providers and probably getting 10 different recommendations, some that align and some that are probably complete polar opposites each time they go to the doctor. So it can feel really overwhelming to manage all of those symptoms. But we know just movement in general from a physiological standpoint, that research supports that movement can be so helpful to manage symptoms of PCOS, not only to impact, our insulin sensitivity and help to balance hormones. We know that the more we can be consistent with activity, the more that we can control kind of general aches and pains throughout the body, and how much of an impact our physical health and exercise or movement practice has on our mental and emotional well-being is such a big piece of things too. And I think I think sometimes because the information can feel so overwhelming and disjointed that it can feel like it has to be really complex in order to be helpful, but movement does not have to be overwhelming. Even being more mindful of movement throughout the day can make a really big difference, such as going for a short walk during a work break, doing little micro workouts. I like to do that throughout the day when I'm seeing patients. I can feel really stuck sitting in a position for hours at a time. So maybe in between meetings or patients, I might, stand up, and then I might do some squats or like a wall sit or something like that, and then maybe also just little changes like parking a little bit farther from a business or something to walk in, having a walking pad at your desk. So all of the simple ways that we might be able to incorporate more movement into the day, and just making it less complex, and knowing that it doesn't have to be some specific movement pattern or some really novel crazy movement in order to be effective.
Hmm. Yeah, I definitely agree. And you mentioned that it doesn't need to be very complex. Do you think there are like some common mistakes that people with PCOS make because of that when it comes to like fitness and movement?
hmm Yeah, so like I was saying, I do think people with and without PCOS often make fitness and movement kind of more complicated than it needs to be. I
Hmm.
think we're as creatures, we're always kind of looking for like the newer, novel, better thing. And I think social media plays an aspect in that. We're scrolling, we see some new exercise and think, oh, that's what I need to be doing. Or this expert is telling me I have to do this crazy movement and that's going to fix all of my problems. And I think when we move from like fad to fad, or new type of exercise to new type of exercise, and are always looking for novelty, it sometimes renders the activity to almost be less effective, because our
Hmm.
body really just responds to consistency. So I think when we seek a lot of variety in our workout routines, that often leads to less effectiveness and maybe more inconsistency. So often the most effective workout programs are the ones that are just boring and basic. So, if you're somebody that likes to lift weights and you have PCOS, it doesn't have to be some new routine every single time. Do what feels good in your body. Focus on the muscle groups and movement patterns that feel good to you. It doesn't have to incorporate all kinds of novelty. We know that there are certain types of movement, pushing, pulling movements, squat movements, make it really functional, and just really basic. And then you don't have to be worried about coming up with something new every time. You just go and you put your headphones on and focus on something else while you're doing it, and then you're more consistent in that way. We also know that from research that like I said, the more consistent we are and the more we can kind of cross train, the better. So I think that's also a mistake that, again, everybody kind of makes, is really hyper focusing on one type of activity or exercise, when in general, our bodies do like a little bit of cross training. So again,
Hmm.
it doesn't have to be new or novel, but maybe it looks like I lift weights 3 days a week, and then I do some kind of cardio activity that brings me joy a couple days a week, and then maybe a yoga flow or like a stretching routine 1 to 2 times a week. But I'm just really consistent with that. So then I build in a little bit of strength, little bit of mobility, little bit of cardio, so my body is getting challenged in all of those different ways. I think another misconception that people make too is that fitness and exercise has to look one particular way. So we think, okay, in order to say that I worked out, I have to go to a gym, I have to have workout clothes on, it has to be 60 minutes, and it has to meet all this criteria. I have to sweat, I have to feel all these things. When in reality, it doesn't have to look that way. Exercises at home can be just as effective as at the gym. A 30-minute workout can be just as tiring as a 60-minute workout. So we don't have to be in yoga pants to like be doing yoga. So I think just reframing movement and exercise so that we don't kind of fit into this box of, well, if I can't make it to the gym, I might as well do nothing. Again, I think it's just about consistency. So showing up with whatever you have in whatever amount of time that you have, but doing it consistently is always going to be better than showing up to the gym for 60 minutes every once in a while. So I think just kind of reframing what exercise and fitness looks like is really helpful. I would say too that it's not really a mistake, but more so maybe a barrier, especially with people with PCOS, is they might feel that they no longer can do a certain type of exercise, maybe a type of exercise that they've always really loved, now kind of causes some irritation for them or some pain. And I completely understand that that might bring up some frustration and some sadness or some grief that somebody might have over feeling like, well, I always loved this exercise and I feel like it just really bothers my symptoms, but I feel like sometimes we get stuck in that grief, and maybe instead of getting stuck there, it can be a both and situation of, yes, I'm sad, I feel like I can't do this activity right now or yet. However, these are all the other activities that I might be able to do. So again, just kind of thinking outside the box about how to modify what we love, or finding new ways to move our body that feel good with the symptoms that we're currently having, and trying to let that still bring us joy in like a new movement pattern.
Yeah. I definitely
Yeah.
think like consistency, as you mentioned, but also like variation is super important, no matter if it's like PCOS or just like managing your physical health generally. But I
For
was
sure.
wondering, I know you said that like there's no specific like workout routine or like something that people should always follow, but are there like any specific exercises or just like lifestyle changes that you recommend to people with PCOS?
Yeah, I mean, I would say again, kind of having a mix of types of exercise. So if someone can tolerate, if their symptoms can tolerate some amount of resistance training is always, research is going to usually support that as being one of the ways. Building muscle is going to be a way to help with our insulin resistance and our metabolic capacity and things like that. So to not be afraid of lifting weights, and knowing that it doesn't have to look a specific way. I don't have to be in the squat rack to be lifting weights. That can look any combination of things, but definitely some type of resistance training that feels good for your symptoms. And then also from a cardiovascular standpoint, having some amount of cardio. Yes, resistance training is going to increase our blood pressure and heart rate for short periods of time, but also really important to have those cardiovascular reserves. And we know that a lot of times PCOS might come along with other chronic conditions like POTS and other kind of cardiovascular conditions. So good to be integrating something in from that perspective as well. And then it is really common that, if we have a pain condition, especially with like endo or PCOS pain in the low abdominal area, pelvic pain, that it's common that we might also develop low back pain and hip pain and thigh pain, and feel like it radiates kind of from our abdomen down to our knees sort of situation. So having some amount of like mobility training is good too. So whether that is, if yoga is your jam, so whether it is going to a yoga class or something, even if it's a slow flow or a restorative class, can feel really nice.
Mhm.
Or if you're not into yoga, maybe having some kind of myofascial release consistent program that you do at home with like a little trigger point ball that you lay on and kind of work out the tension and the muscles in your back and your glutes and your thighs and things like that. So a little bit of something from each bucket, something to kind of build the strength, something to build the cardiovascular fitness, and then something to support your mobility would
Mhm.
be probably the best combination of things.
As for like weight loss, which I know a lot of people that have PCOS are really pressured to like focus on weight loss.
Mhm.
Do you think we can shift that focus into feeling like other types of like exercises that are not just focused on weight loss? Or what do you think around that entire conversation around weight loss?
Yeah. So that's a tough conversation, right? Most patients that have PCOS are really educated on that, and that's sort of pushed as like such a big goal. But we all know how frustrating chasing a number on a scale can be,
Mhm.
and often how disappointing that can be because while it is one metric of weight loss potentially, it's not always the best metric. Neither is BMI. We know all of these are sort of imperfect measures to some degree. So there might be some recommendation that a provider is giving in terms of like a number on a scale, but also recognizing that if I'm building strength in the gym and my muscles are getting stronger, then I am going to be gaining a little bit of muscle mass and a little bit of weight associated with that. So there is always that balance out sometimes. So I think I always try to encourage patients too that instead of only focusing on the number on the scale and getting frustrated with that, or maybe frustrated with how slow that seems to be changing, look also at how your function is changing.
Mhm.
So whether it's a lot of times with my pelvic pain patients, I encourage them, instead of looking at like their numerical number, their pain rating number changing, try to look at how your function is changing. So, with your consistency, are you able to maybe your symptoms are not as bad at the end of the day as they used to be, or maybe with your consistent workout routine, now you can go on a hike with your friends and it's not as tiring, or you're able to run more errands after work without worrying about your stamina, and you feel like you can be more efficient on the weekend. So trying to notice how your routines and your effort is creating functional change, not just objective numerical change, I think is really important, and oftentimes a lot more motivating, because yes, it is frustrating if the number's not changing, but ultimately, if I'm able to be more functional, more a part of my life and the things that I want to be doing, interacting with my friends and family,
Mhm.
then that also is going to be very motivating. So I think sometimes focusing on that functional change is really important.
Yeah, I definitely think like the phrase just like feeling good is always better. Like I
Yeah,
think that definitely applies here.
for
Um,
sure.
but also for people struggling with like fatigue, whether it's based for like PCOS or for other conditions, how do you think they should incorporate movement and like physical activity without feeling like it makes it worse?
Mhm. So, I mean, I think the first tip is probably the obvious tip, but so many people maybe don't actually put it into practice. So, again, like if we need to kind of get out of the box of, well, I have to, in order for it to be a good workout, I have to be doing 30 continuous minutes or 60 continuous minutes. Depending on somebody's baseline level of function, three 10-minute walks can be just as effective as a 30-minute walk. And maybe the goal is to get up to 30 minutes, but it's fine if you're starting with like shorter, more frequent bouts of exercise or movement. And then over time, those can like mesh together to include larger, chunks of time. And to really base that off of your schedule, your kind of baseline function and your symptoms and all of those things. So I would say the first step is just to break up the time if you're feeling really fatigued by the exercise, if you can. Also being smart about our energy kind of conservation techniques. So just noticing how maybe a lot of us would be more fatigued if we're always working out at the end of the day after our work day at like 5 o'clock, 6 o'clock at night or something like that. So if you can, like we're all gonna usually have more energy in the morning. So trying to shift those workouts or activities that are going to be more taxing to our system to earlier in the day, or choosing days where we don't have as much that we have to do, or maybe it's not as stressful. Also making sure that we're fueling and hydrating ourselves. So a lot of people might not, always, if the goal is kind of weight loss, then sometimes we get in our heads that like, well, I'll exercise on like an empty stomach and then it'll be more beneficial, but we know that that's not really true from a metabolic standpoint, and it is going to fatigue us faster. So if you're working out, you need to be fueling and hydrating yourself for that activity, and that could be a big culprit of fatigue. Also knowing what your, electrolyte levels are. If you're losing a lot of sodium or losing a lot of magnesium, that could also be a really big factor in getting really fatigued after exercise. And then I would say too, just modifying the environment. So as much as possible, thinking about your surroundings. So, if we're always exercising in like a hot environment, obviously trying to move into like a cooler environment, or maybe even into the pool or something like that. Even for some people though, like just more distracting environments are depleting. So maybe, if they're going to a really busy gym and they're going at a time of day, maybe they're trying to go to the gym early because that's when their energy's the best, but that's also when everybody's at the gym and it's really high loads of people and distraction and music and lights, and that's really depleting for them. We need to kind of know that about ourselves and maybe try to, find either space in the gym that's like less distracting or less fatiguing, or find a space that is more quiet, like another type of gym space, or moving it at home. Because I think a lot of us don't take into consideration how exhausting it is just to be in distracting environments. And so then if we're expecting our bodies to sustain us through a physical activity in that environment, it can be really hard sometimes. So just noticing that in ourselves too.
Yeah, definitely. I feel
Yeah.
like physical like exercise is so beneficial, but also you need to be cautious about like how you're doing it and also taking care of your health in like other ways while doing it. And for like a lot of young women, especially starting in like high school, they deal with a lot of stress, and it also plays a huge role in PCOS. So what do you think like are some effective ways to manage that through movement? As you mentioned, like it can be helpful in many other aspects as well.
For sure. So stress is definitely a part of life. We can't escape it. Most patients, I would say, they can notice an impact of stress on their symptoms, no matter what they're dealing with, whether it's pain or fatigue, whatever. We're all going to have some sort of reaction to stress. So the goal is really to learn how to manage that stress more effectively so that it doesn't impact us quite so heavily. And like we've talked about, we know that movement is such a big piece of decreasing stress and decreasing anxiety, improving mental health. And like I was saying, trying to find environments where the exercise and movement is not as stressful. So not loud gyms if possible, and all that kind of stuff. I also do notice though with a lot of patients that, I might be talking to them about stress management techniques, and I'll say, okay, are you going for like a walk after work to help sort of decompress from your busy job before you have to jump into XYZ at home? Or like if you're in school, from school to transition into like dinner time with family and that kind of stuff. And they'll say yes, and I'll say, okay, what are you thinking about on your walk? And they're almost always like still with like headphones in, and maybe they're talking to somebody or they're listening to a podcast or listening to music. And sometimes I'll encourage patients to even try to stop that, because we are so inundated with just constant information and like
Mhm.
constant input all day long, and whether it's like noise in our environment, lights in our environment, people talking to us interfacing with people. So If someone is having a really hard time with kind of managing stress, I do think trying to limit as many inputs as possible, even for just short periods of time, can be really helpful. So maybe it is, you know, could you go for a walk without headphones? Could you even go like without your phone and just be kind of present and use that as a time to also be practicing some mindfulness techniques? Really noticing like the birds and the sky and the sound of the wind and like all of the things that we know naturally, like connecting with nature, connecting with our environment around us, trying to get that embodiment sensation, feeling like our brain is in our body, is so critical in teaching us. That mindfulness is so critical in helping to process that stress and gives our brain like just a second to stop processing so many inputs. So it doesn't have to be for super long. I know that's a really big ask for a lot of people, but sometimes it can be helpful. Sometimes I've even had patients, I've said, okay, no more walking because they can't do that. I'm like, how about you go tread water so that they like can't take their phone or they like don't want to take their phone in the water or something. I'm like, just go tread water for like 10 minutes, be away from your phone, leave it in the house kind of thing. So that's like a natural barrier. I also think just trying to, manage stress as much as we can through different, like, again, instead of always reaching for like a distraction and like watching how much we reach for like our phones when we're maybe like say in a waiting room waiting for a doctor or something, we're just like scrolling on our phone and kind of like tuned out while we're just waiting. But that could be a really great opportunity to do like a little stress management exercise. So maybe instead of grabbing my phone, I put my phone, face down, like on the table next to me or on the treatment table or something. And I do like a little grounding practice where I put my feet on the floor and I notice the weight of my feet on the floor. I notice any tension in my feet, in my ankles, in my thighs, kind of like moving up my body. Maybe I close my eyes if I feel safe to do so. And just start to like notice and drop into that present moment, even in those tiny little snippets throughout the day. Because usually when we're in that stress and anxiety realm, it's our brain kind of going to the future and like worrying about the what ifs and all the things that we have to do. Whereas if I can move into the present moment and kind of drop my body and mind together in the same place, there's really nothing to be anxious about in this moment. I'm in a controlled environment, I'm safe, I'm clothed, I'm fed, like all my basic needs are met. So there's nothing to really feel stressed about right this second. So sometimes that can just be a tiny little moment for our brain to sort of recognize that we don't always have to live in that like up regulation stressful zone. And I think it's also it can be easy once it's a practice to start to increase our breathing awareness throughout the day and things like that too. So that's always something I'll sometimes give to patients is no matter where you are, maybe it's in between meetings, in between classes, like whatever, even just taking like 5 big deep breaths or belly breathing or breathing in for 4 and extending your exhale to 6. Like there's all different kinds of pranayama practices that help to reduce tension and anxiety, and you can take that with you anywhere. So if you can just prevent yourself from grabbing your phone every time you're kind of bored or you're like in the middle of 2 things and get in a practice of doing something like that instead, like a grounding practice or a meditation or a breathing practice, those are like little glimmers and moments throughout the day that you can be helping to reduce your stress in that way.
Yeah,
Yeah.
I think like even with like so much stress, like and also digital media can be like helpful, but I feel like mindfulness should be prioritized definitely in the like recent years because it's not been in the recent years. But yeah, like
Yeah, for sure.
and also for like you mentioned like pranaya and like your background in yoga, how do you think it can specifically support like hormone balance and like overall well-being?
For sure. So, I of course I do yoga and I teach yoga, so I'm going to be a little bit biased, but I do really feel it's not the only movement practice I do, but I do feel like it offers so much and such a wide variety of things that it can help and can guide somebody through. From a hormonal standpoint, I think the biggest thing that yoga and like well-being standpoint, I think the biggest thing yoga can do is to lower stress and our nervous system, like fight or flight upregulation, through different movements and poses, through synchronizing our breath and just focusing on our breath in general. It's so helpful for our nervous system, to down regulate some of the like fight and flight response that we're all sort of chronically in throughout the day. I think yoga is such a great practice too because it does offer such a wide variety. So whether it's like restorative or yin or hot yoga, whatever, you can kind of use the different types of practices to maybe cycle sync as well. So cycle syncing is such a big focus now, from like an exercise standpoint. So if that is something, it is important for us to be in relationship and in good understanding of our cycles and how it impacts various parts of our cycle, impact our physical, strength, endurance, fatigue, as well as our mental, emotional well-being. So yoga is really great because you can do different classes or focus on different things, like usually during like more menstrual phases and then maybe into like luteal phases, like a yin yoga and a restorative yoga might be really helpful to kind of help with that like shedding process, because those times of the cycle are really associated more so with like that energy kind of leaving our system. So doing practices that kind of give back, so more restorative, more slow kind of yin stuff. And then when we kick into like ovulation and like follicular phases and things like that, then that's where we can start to sort of build more heat and sort of get some movement more going. So that might be where we're doing more of like a traditional flow type of yoga, or like a hot yoga, or kind of more upbeat Ashtanga sort of yoga. So you can use the different types of practices in various times of the month to help like cycle sync too and support that.
Yeah.
Yeah.
That's really interesting how there's like so many types of yoga. I personally like never knew of that, but
Yeah.
it's also really cool how they can be like used in so many different ways. From like a physical therapy perspective, are there any issues you believe that people with PCOS should be mindful of?
Yeah, so other than the things we've talked about in regards to like movement and exercise, I would say one of the biggest things that I see with PCOS is that there's often pelvic floor tension as well. So it's very common, whether with really any pelvic pain condition, that if I have sort of chronic pain, especially in my low abdomen, it would be normal for then the muscles around that area to hold a little bit of tension and guarding. So very normal to have signs and symptoms of pelvic floor tension related to PCOS that might wax and wane depending on how the PCOS symptoms are presenting, how intense they are on a particular day. But common symptoms of pelvic floor tension would include, from a bladder standpoint, maybe trouble starting a flow of urine, trouble emptying your bladder, could be frequency, urgency, leaking, anything related to that, pain with bladder filling or emptying. From a bowel standpoint, could be pain with bowel movements, or trouble emptying, needing to strain. Could be sexual dysfunction, so pain with intercourse with like initial penetration or deep penetration or both. So again, it's really common to have that pelvic floor tension, and I think is really critical to make sure that whoever your kind of primary quarterback is of a provider that's helping you to manage all of these symptoms, to make sure that as part of that team, there's maybe a pelvic PT that is a resource to you or that you know about, so that if those symptoms do come up, making sure that your provider makes that referral to a pelvic PT, because that would be the most appropriate provider to help treat signs and symptoms of pelvic pelvic floor dysfunction. So don't let your provider dismiss any of those symptoms or tell you that they're normal. There's definitely lots that you can do from a pelvic floor standpoint. So just making sure that you speak up about those symptoms and being mindful of if any of those symptoms pop up in relationship to maybe, getting more active with exercise and activity and all of that kind of stuff.
That's really interesting. I haven't heard or like looked much about like pelvic pain and its relationship with PCOS, but
For sure.
hearing that like is definitely important for a lot of patients because I'm not sure if like they think it's common before they actually have like symptoms and stuff like that, but yeah.
hmm Yeah, I do think a lot of patients they either are told or they believe that, oh, it's just normal to have XYZ, or everybody leaks once they're a certain age or something like that, which is just like not true. It's common, but it wouldn't be considered normal. So yeah, definitely making sure that if there's any symptoms of that's being addressed as well.
Yeah, definitely.
Yeah.
If you could give like a last piece of advice to close off to someone feeling stuck with their PCOS journey, what would that be?
I would say, just having treated complex kind of conditions for helping to treat that with patients over the years, what I notice is just that the people that tend to do the best are the ones that recognize that the symptoms are usually multifaceted, and then it really takes a team approach to help all of the symptoms, right? So, not putting all of your eggs in one provider basket, but knowing that, like, okay, I need to create a team of people, especially as you get more specialized with your providers. Their area of focus is going to get smaller and smaller because they're more of a specialty. So they're not going to be able to help all of the different symptoms that might come up with something like endometriosis or PCOS. So we need to make sure that we're seeing somebody who's a specialist potentially for the different symptoms that we're having, and recognize that it might take that team approach. So I would say, big providers that you'd want on your team, potentially some kind of specialized gynecologist or minimally invasive gynecology surgeon, a pelvic PT, obviously, I'm going to say that, maybe a nutritionist who actually really understands PCOS and other types of conditions similar to that, not just any nutritionist, because I know that can be very frustrating if they're not really trained in PCOS particularly. So somebody that has that background. More and more evidence is coming out around the benefit of acupuncture and PCOS and pelvic pain conditions. So maybe you have a great acupuncturist or massage therapist that really helps you. And then if you have, bladder symptoms, having a good urologist. If you have GI symptoms, having a good GI or colorectal surgeon would be helpful as well. So just making sure that whatever your symptoms are, as you get more specialized, making sure that you have someone in all of those specialties to help you, and then a quarterback or a really good primary care provider that feels like they can help you kind of manage all of those things together, because it can feel very, very overwhelming. So building a team that you trust, and just recognizing that it's often not one specialty or one treatment that takes all of it away, or that is like the number one thing to focus on. It usually involves a little bit of everything. So the people that tend to do the best have this really good team that's supporting them, and then they are consistently doing most of the recommendations that help them, helping with dietary changes, stress management, movement practices, good sleep hygiene practices. They're getting some myofascial work in, they're taking care of themselves, all of those things. And when someone's really consistent, often doing the things that help them the most and doing all of them together, those are the people that tend to find the best relief.
Yeah. I think it's really important, like you said, to have like a multifaceted approach. And thank you so much for like
Sure.
explaining it so much. Um,
Yeah.
but yeah, I think that's it for today's episode. And Dr. Hill, I really appreciate you taking the time to share your insights. So
Of
many
course.
people don't realize how much like physical therapy can play a role in PCOS management and overall health. But thank you for shedding light about that and how it affects like all aspects of our health today.
course. Yeah, thanks so much. I appreciate
Yeah.
it.
I hope more people will walk away from this episode with like a new perspective, like I did. And for everyone listening, PCOS is a complicated condition, but the more we understand it, the better we can advocate for ourselves and find how and what it works like. So if today's episode gave you something to think about, pass it along to someone that might need it. And for those with PCOS, don't let it keep you stuck. Instead, keep learning, keep asking questions, and keep moving forward, literally and figuratively.